It just pulled, right off. It didn't hurt. It didn't break. It just came off as one big chunk. Last year, actually, I was eating some chewy candy, and a crown that I'd had for many years just kind of peeled right off. Mostly it was more functional than anything, just worrying about, what I eat, and especially on the right side, because, what if this just progressively gets worse? So I, of course, went to my dentist, and the dentist looked at it, kind of poked around at the tooth that was underneath there and said, there's no hope really left for this tooth. Having gone through the implant process before, I kind of figured that's what I would need, would be to have an implant. The dentist referred me over here to Dr. Epstein, and just to have a conversation with it to see if that's something that is viable. And they looked at it and said it was a viable option.
Matthew came to us as an experienced dental implant patient. He had 2 implants previously placed in his upper jaw. Through that experience, he understood that implant placement was a really drawn-out process that took a lot of time. For him, when he came to us, we placed an immediate implant in his lower jaw, and that was a really quick and painless process. He was quite surprised by that, but we were able to get him back and restored with a new tooth in just under 4 months.
I mean, it's never something you want to hear, that you have to have your tooth pulled and all of that and go through the process. But everybody was really nice and really kind of set me at ease. This is the 3rd time I've had to go through this, and this is my 3rd different location that I've had an implant done. And it was by far the best, most calming atmosphere that I walked in. After the procedure, instead of having to take the painkillers that they prescribed, I didn't even really need them. I took one, I think, after the procedure when I got home, just to kind of get ahead of any pain that might be there. But afterwards, there wasn't really any. It was uncomfortable a little bit, and, I just had major oral surgery, so obviously it was, it wasn't the most comfortable thing in the world, but nothing really hurt to the point where I needed anything more than, a couple ibuprofen. So it was really different in that regard. After going through the procedure and getting everything done, I don't have to worry so much about when I'm eating, what I'm eating, things like that. Dr. Epstein really did make this a very painless procedure.